yes, sir, we can move ahead with the next slide.
Perfect. I'll do that. All right.
Yes. Yes. So basically, this is the content outline that we will be discussing today. The first thing is I'll be talking about a little bit about how I transitioned, how and why I transitioned into medical writing. And then we will speak a little bit about the basics of medical communication and its various deliverables. Then we will try to focus on 5 important signs that say that you can explore this field. You can go ahead as a freelancer in this field. Then we have 5 things to keep in mind when you start your freelancing journey. These are very important things, small things, but very important. Then we talk about your niche, finding your area of expertise. Niche is basically the area where you would love to work for the coming years. So that is another important area that you need to identify. After that, we move on to 3 things to consider when you are starting out. Landing your first client is a very important part. And I know there are many people, everybody they reach out. I am sure they reach out to Manoj sir also, like how to land a client. And that is a key question that actually comes up in our minds when we are like, everything is fine, everything is happening, but how do we get that first client? So that is another important thing that we want to discuss today. And becoming a go-to freelancer. See, freelancing scenario is very competitive nowadays. And if we don't focus on our quality of work, then we are losing out on a lot of opportunities. So that is another important part. Of course, then there are some pricing strategies, how you can set up your rates as a freelancer. So we are talking on that. Then we have some contract obligations. What kind of legal obligations you have upon you when you start as a freelancer? We tend to miss upon this whole part. We focus only on the writing and drafting and client contacts and everything, and we miss out on the the legal part of being a freelancer that comes with being a freelancer. But you need to know that because you don't know when you can step into a pit hole. So that is important. And yes, then we have some lessons that I would suggest I have learned from my journey, and I would suggest you keep in your mind as you go about in your journey. Okay, so yes, my story. So my story is basically not very interesting, but I will tell you. I am a pediatric dentist, and I completed my MDS I'm actually from West Bengal, Kolkata. And I completed my MDS from Dr. R. Ahmed Dental College, Kolkata in 2019. And after that, during that period, the pandemic was all over, and clinics and our, hospitals, neither were they taking in patients, nor were they taking in dentists. So basically, we were jobless at that time. So we did not have clinics to attend. We did not have hospitals. I was like at a loss of what to do right then. And it was at that time that I thought about pushing myself a little bit into something and exploring something that I have loved since I was a child. Actually, I have been writing I'm into medical communications for 4 years, but I have been writing since I was a child. And they could be poems, they could be essays, they could be, those small things that we write in our schools, in our colleges. And I was always that person who used to beg the first prize. So I somewhere down, I knew that I was that person who had that, you can say it a skill of reading and writing. These two were the main passions that I had in my life. So, but never really had an opportunity to explore writing beyond my academics. So I thought I had a lot of time back then in 2019-20, and I thought, why not explore something in this field? It was then that I came across this term, medical writing. I did not even know that there was something like this at that time. So I came across this thing, and then gradually I started Googling more about it, reading about it. 2 important resources that have helped me a lot. One is the American Medical Writers Association, and other is the European Medical Writers Association. They have free resources. They have free articles which you can read, and they will give you a very, very in-depth scenario of what is going around in this medical communications, medical writing. You can understand, you can get a basic idea. So those 2 resources helped me a lot. And after that, of course, I gradually started finding internships because I did not know any better. I did not know what else to find. So I started finding internships, and I landed an internship opportunity after, say, 6 months after I started searching for internships. And that was with a medical communications agency based in Delhi. And it was a small agency, and they took a writing test, and they said, okay, so you can join as a like trainee or an intern. And I was the happiest person because I was wanting to get that exposure. So I worked for 6 months with them as an intern, and after that they offered me a position as a medical writer. And I went ahead with that medical communications agency for over 2.5 years. And during my days in the medical communications agency, I was learning a lot of things. Of course, I had my academics behind me. I had that medical knowledge, medical science knowledge with me. But then there are different kind of formats that we write in medical communications, and we are not at all trained during our academics about all these things. We did not even know that these things actually existed. So all we did was writing those, papers for journals, scientific papers, our theses, our datas, and all those things. So yes, that was a very new experience for me. From then, after 2.5 years, uh, I was feeling a bit stuck with whatever I was doing. I was feeling that I need to, expand my uh, area of work. I need to learn new things. So it was at that point that I decided to start freelancing. And after say 3 months, 3 to 4 months of being consistent on LinkedIn, I landed my first freelancing client, and I grabbed that opportunity. And after that, I kept being consistent on LinkedIn, and gradually clients started noticing and reached out. And it has been a journey since then. Okay, so basically, what is medical communications? I think some of you are very new over here, and some of you might have some knowledge about medical communications. You might be working also in this field. So, for those of you who are very new to this medical communications, you need to understand the whole spectrum of drug development process. See, whenever a new drug is discovered or developed, first of all, it goes through preclinical phases and clinical phases, right? After that, it gets approval, it comes to the market. Now, after it comes to the market, then it comes upon those manufacturers to market their product, to educate the people about their product. So the part that comes under these preclinicals and clinical phases, that is mainly the regulatory medical writing. And after it comes to the market, after it is approved, it is coming to the market. After that, the marketing part and the educating part, basically these are the two important aspects of medical communications. So we are trying to communicate whatever knowledge, whatever study knowledge, whatever trial knowledge we have about a drug, about a vaccine, say about a medical device. We are trying to communicate that to a wide range of people. I will say stakeholders in the healthcare field. For they can be patients, they can be doctors, they can be nurses, even sales representatives who come to clinics and they give out these brochures. Even they need some kind of training to understand what they are going to talk about in a clinic. So all these things actually come under medical communications. And the main aim of this medical communications writing is it can be a promotional kind of thing, like we are trying to promote a drug, we are trying to promote a device. That is one part. It can be just education, just to create a kind of awareness about a particular drug or a product in the market. So these are the aims, or our objectives that the different clients come to us with. So yes, that is in a brief of what medical communications is actually about. Okay, now coming to the deliverables, as I have already told you, like basically we are focusing on two main areas. One is the educational part, where we are trying to make the general people aware of a particular product, its usefulness, its side effects, how to use the product. So how to guides. So infographics. So these are basically coming under the educational part. Then we have the promotional part. That is, we are trying to promote a particular drug. We are trying to rebrand a particular drug. Okay, so these are the different kinds of promotional literature. They are also known as medico marketing, field. So these are the different kinds of things that we want to learn in the promotional field. So yes, if we talk about the different kinds formats, then we have one very common format is the website content. I'll give you an example. Say I am a dentist. I have my own clinic website and I write about oral health topics over there. So I am not good at writing. I hire a medical writer to write about different health conditions and how it is related to our whole body. So that is one area of work, website content. Okay. Then we have health and wellness blogs. There are this health media companies or websites who can hire these freelance writers to write about different diseases. Okay, that is one. Then we have these training modules. Like I told you that sales representatives, they also need some kind of training to understand, right, what they will sell to the doctors. So that is important. Then we have these slide decks or these leave behind literatures for healthcare professionals. That is another part. Visual aids and infographics are gaining traction very rapidly nowadays because we are overwhelmed with written content. And visual aids are a great way to communicate your idea to the general people. They understand it better, they retain it better. So yes, visual aids. Then we have patient leaflets. Then we have white papers and position papers. See, I will not be going into very details about what kind of things these are because that will take another hour. And just search them out. You can find all these things like what are white papers, what are position papers. You will understand. Plain language summaries, like Sir said, plain language summaries are also gaining very traction. Nowadays, it's very important that if you are in this medical writing field, try to gain some amount of insight into what plain language summaries are. Then we have book chapters. Yes, there are medical writers who get hired to write whole book chapters. I have never done it, but I know my colleagues who have worked on it. Then, of course, we have some product monograms and product descriptions. These are, again, promotional kind of thing. So, yes, these are the different formats you can explore as a medical communications writer. Okay, so where do medical communications writers work? That is the most important question. So one of the main verticals where you can work as a medical communications writer is medical communications agencies or companies. They hire either in-house writers or freelance writers to work for their clients and deliver these different kind of deliverables. That is one area. Another vertical where you can work as a medical communications writer is CROs. CROs are basically contract research organizations. Big pharmaceutical companies, there are many pharmaceutical companies. What they do is they outsource a part of their work to these CROs, contract research organizations, so that these work can be outsourced and done by those contract research organizations in collaboration. So that is another organization where medical communication writers can work. Then, of course, we have these health tech, femtech companies. These are basically not manufacturing. They are coming up with technologies that can help advance healthcare. It may be women's health, it may be oral health, it may be diagnostics. Okay, so these are the various areas where, especially like one of the very popular things that are coming up now are AI assisted diagnostics. AI assisted diagnostics are gaining traction very rapidly, and that is an area I think which is going to boom in the coming days. So these are areas where medical communication writers can actually work. So with that, we come to like what kind of work relations you can explore as a medical communications writer. See, this is a very obvious slide. There's nothing much over here, but still I will tell you a little bit about it. First of all, of course, you can get offered in-house full-time opportunity with a CRO, with a medical communications agency. That is one way. Another thing is you can fully freelance. Okay. Now, see, these freelancing opportunities can be one-off. One-off means like you are working with one client for one project, and that's it. Or it can be on a retainer basis, like you are working for a client on a monthly basis. Okay, so you get hired for say 6 months to work on say 3 projects, or so to work on say a single project. So that is, you are working, you are a retainer with them. Okay, so these are two kind of freelancing scopes that you can explore. Another is, of course, all of you know, it's hybrid. That is, it's a mix of some days in office, some days from home. So it's all over the place right now. So these are the different kind of work relations you can explore. The most important thing that I want to highlight over here is that in case you are freelancing, one thing you need to keep in mind is your work flexibility. You are getting a large amount of work flexibility. To work from your space, and that doesn't exist if you are doing an in office, or especially in office full time, like 9 to 5 you are doing with a medical communications agency. That becomes a full time job. But when you are at home working at your own pace, you are freelancing, so that work flexibility is one of the best things that I have experienced in my freelancing journey. Yes. So moving ahead from here, see, like 9 to 5 job is not for everybody. Okay. But freelancing is also not for everybody. So there are some things you need to, tune into your mind, like before you jump into being a freelancer. So here are 5 signs that probably freelancing can be your calling. First important thing is you want to explore career opportunities, alternatives. What I mean by career alternatives is, yes, like sir said, it needs a mind shift. Of course, freelancing needs a mind shift. So basically, why I'm saying is that you want to explore career alternatives. See, today's world is not only about going doing what you have learned or what degree you have. Okay, people are trying to explore their skills. Basically, what I'm trying to say is that the whole job field is becoming skill based. It's not only what degree you have and what academic background you have, but your skills are as much important. So if you think that you have a skill of reading, writing, okay, and researching, if you think that yes, you can do that, then definitely you should try freelancing, because that is a skill you have. And if you don't explore it today, probably 10 years on from now, you will feel, oh my God, why didn't I explore it? So do it, explore it. And the second thing is, you don't have a job satisfaction. Of course, you are working in your field, but then you do not see any growth. And growth, always doesn't mean that it has to be financial growth. There has to be a kind of, job satisfaction. If you don't have that job satisfaction, if you are not satisfied in your mind with what you are doing, then that is also that you are not growing. Okay. So keep these things in mind. And if you find you resonate with any of these things, you are suffering or you are going through any of these feelings, then I think you should give freelancing at least a try. After that, we have, yes, difficulty in fixed hours in office. That is, of course, if you are not able to work from office 9 to 5, if you do not think that that kind of, job structure is for you, then obviously freelancing can be your forte. Another is entrepreneur mindset. And you should be a risk taker, because when you start freelancing, everything looks very rosy. You will be working with international clients and whatnot. But the fact is, even after 3 years, 4 years, you can face a setback. A point can come when you will lose clients. You can lose clients. It can be your fault. It cannot be. It might not be your fault. But phases like this comes to the best of the freelancers. So if you are prepared to jump into that, then definitely freelancing is for you. Another important thing is you want to explore diverse therapeutic areas. See, this I'll try to explain with one of my personal experiences over here. When I was working in that medical communications agency, I what happened was I was working on I was learning a lot of things, but I was working on some set you know topics, and I was not growing beyond that. uh, and oral health was not one of that. And I very much loved writing about oral health and blogging about oral health because I have that expertise, right? I have that academic background. So but I was not able to explore that. So that if that is the case, that you are trying to explore different therapeutic areas but somehow you feel that your work is restricting you from doing that, then of course you can try freelancing, because as a freelancer you will be working on multiple topics with multiple clients. So that is another thing. Oh, another important thing is, see, all of these will align better if you have a love for reading, writing, and researching. If you don't have this basic, love for reading, writing, researching, then nothing can help you. I'm sorry to say, but you cannot. You will start, of course, but you will not be able to sustain it in the long run. Okay. So now breaking into the freelancing landscape, here are 5 things you need to keep in mind when you start. Like Sir said, basically, freelancing needs a huge mind shift. And it doesn't happen in one day, it doesn't happen in 1 month. It happens gradually and it takes time. So if you are ready to give in some efforts, to give some amount of time to freelancing, then think about it. First, most important thing is whenever you are trying to start freelancing, don't quit your regular job. Don't do that, because what happens is, from your regular job you are having a stable income, right? And once you start freelancing, it will take some time to catch up, to get that first client, and then gradually gain more clients. And even when you start gaining more clients, what happens is there are many ups and downs. Like you work with 3 clients for say 3 months. After that, one client somehow decides to close that project, and you are left with 2 clients. 1 month later, another client decides to close another project. So your income doesn't have stability, especially in the initial days. And you will not be able to predict these things. So it's important that you have a financial buffer. You have some amount of savings in your bank to fall back upon if you don't get good jobs or good opportunities initially. That is important. Another thing is wearing multiple hats. See, when we become a freelancer, it's not only about writing and drafting. Uh, it's not only about that. You have to send invoices. You have to keep a track of your accounts. More importantly, you have to keep reaching to new clients to get more work. So keep your business growing. Okay. So all these things will add up, and it will add up in an instant. So you have to, whenever you are trying to jump into freelancing, you have to think of all these things, whether you will be able to, mentally tackle all these things. Because once you understand it mentally, of course, then it will come into your workflow. But you have to put it in your mind that you will be your own accountant, you will be invoicing, you will be reaching out to new clients, you will be working with multiple clients. So many things are going to happen when you start freelancing. Another thing is, of course, time and patience. As I told you, if you are into this only for the money, then it's not a good idea. You need some time and some level of patience to get a steady flow of clients. So time and patience is very important. And I think time and patience is not only for this field, not only for freelancing, it's important for anything and anything that you do in your life. And continuous learning and networking. See, medical field is evolving every single day. A fact or a guideline that is true today may not be true 5 years from now. It may become obsolete. And whatever holds true today, it may be like some new fact has come out, some new research has happened, and that's no longer relevant. That's outdated. So it's very important that you keep learning. Okay, you keep reading, you keep learning, you keep upskilling yourself. And then networking is a big part of freelancing. Without good people around you, without people who have worked, who have been in this field for over decades, you cannot grow. Nobody can. So you need your seniors around you who have gone through your phases, who can help you out if you are if you are facing a challenge. So you need those kind of people around you, and for that you need to keep networking. Yes. So now we have like finding your niche. See, the word niche means an area of your expertise, like that area that you want to write upon. It can be a topic, it can be a format. Like I love to write about health blogs. I love to write about white papers. So that is my niche. So niche doesn't need to be about a particular topic only. It can be about a particular format also. Uh, Now, see, there are many controversies like whether you should niche down initially, or whether you should explore a lot of different therapeutic areas and then you should niche down. I will speak what has worked for me. Okay, what I have done and what has worked for me, I will speak on that. See, what initially happened was I worked on different therapeutic areas, and then I understood that okay, so I love reading and writing about this and this, and then I narrowed down my area of work to those three fields. It's not that even if now I get a client, I will not be working with that client if I get that client to work outside my niche, but I would prefer to work in my niche. So having that said, when you are starting out initially, it's important that you try your hands on different therapeutic areas, different formats. You explore those formats, you try to understand them. Okay, and after that, when you have explored, you will find the area that you want to focus upon. Okay, another important thing is, don't think that once you have niched down, you cannot try different other areas. No, it's not like that. For example, if I am writing on oral health today and that is my niche, tomorrow I may love writing about respiratory health. So my niche will change. So niche can be dynamic. We do not need to stick to one particular place. That is the whole essence of freelancing. You will get to explore different areas. And another thing is, if you feel that whatever you had thought was your niche, your area of expertise is not aligning with your goals, that then you can try to expand your expertise. That also happens sometimes. And initially you will not understand when you are starting out, but gradually you will understand that where you are trying to reach and the niche that you have chosen doesn't align. So if you have some aim, some goal, uh, and if your niche doesn't align with it, feel free to explore different other areas. That is okay. And whatever you do, whatever niche you choose, try to be upskilled in that area. Try to know the latest trends, the guidelines, any consensus statement, any expert statement. Try to know all these things. So that's the whole thing about niching down. Initially try to explore different formats, and after that, of course, you can niche down. Sir, can we move on to the next slide, please? Yes. So 5 things you will need as a freelance medical writer. Of course, every one of you know about this. One is portfolio, another is your resume, and the last thing is you will be tested on your domain knowledge and your writing skills. Okay. So regarding the portfolio, see, portfolio basically means you're writing samples, the best of your writing samples. So whenever a client is reaching out to you, they might ask you for a portfolio and a resume, both. Okay. So you need to keep a portfolio ready when you are trying to freelance. Now the question comes up that if we are a new freelancer and we haven't worked with any client, then how can we build a portfolio? So the thing is that you don't need to work with a client to build a portfolio. You can build a portfolio on your own. See, there are websites like Medium, there are platforms one is Medium, of course, Google Docs, all of you know. In these areas, you can create your write-ups, okay? And you can create folders and you can store those in free websites also, or you can store them in your own website also. Free websites, for example, if you go to my LinkedIn profile, you will see that I have stored my portfolio, my write-ups in clippings.com. So that is one free website. There are many other, like one is Blogger, Wix, then we have WordPress. Okay, so these are different free websites. Of course, some of them have paid versions also. They are not completely free. So that's about it. Or you can build your own website. You can go ahead and do that and store all your write-ups over there. That is also very good option. Okay. Another thing is very good way of building portfolio is voluntary contributions. Like if you can write for a website for a company who want volunteers to contribute write-ups for them. So if you can do that with your, it will come out with your name, and of course you can add it to your portfolio. So that is another way of getting to build your portfolio. Then we have the resume. Now, one important thing that I want to tell you is that keep your clinical and your writer resume separate from each other. Okay. See, when I started out, because I was a dentist, I did not know that I had to prepare a writer resume separately. There were one or two instances where I had sent my clinical resume only, and of course it got rejected. So try to build your writer resume separately, and you will, whenever a client will reach out to you, or you will reach out to a client or to a job opportunity, send over that resume. So one thing is, you build a resume, right? Then say an opportunity comes up and there are some key requirements for that opportunity. So what you need to do is you need to keep your resume relevant to that particular opportunity. How you can do that? You can do that by including your keywords. There will be keywords in your job description, JD. Notice those keywords. Try to include those keywords into your resume. That is very important. And try to keep it relevant in that way. Okay. And of course, the last thing is we have these writing tests. Now, see, writing tests can be of two types. One is to understand your writing skills. Okay. Your punctuations, grammars, your flow, all these things. Another type of writing test can be to understand your domain knowledge. If you are hired as a subject matter expert, okay, there might be agencies or companies who would want to understand your depth of knowledge in that particular area. So they might take MCQs or subjective tests also on a particular subject, on 2 to 3 particular subjects. So these are the two types of medical writing tests you need to be ready with. Okay, so this is the most important slide, landing your first client. See, landing the first client can be very easy for some. For others, it can be a bit difficult. So whatever it is, whatever phase you are in your journey, remember that there are these 5 things that you need to focus upon in order to move towards your first client. Okay. One is networking and community approach. Try to connect with people who are in positions. They may be CEOs, they may be directors, they may be talent acquisition specialists, they may be content managers, they may be senior editors. Try to connect with them. Try to connect with people who can help you with referrals, who have worked with various companies who can help you with referrals. Now, one thing over here is referrals. People usually don't refer new writers, right? If you have some amount of credibility, then only you can hope somebody to refer you. That is another important thing. One of the best ways to reach out to people in this digital area is social platforms. Make use of LinkedIn, because why I focus every time on LinkedIn is because 99% of my clients have come from LinkedIn. And I'm a big believer that LinkedIn can give you a whole free, successful, freelancing business. So try to leverage LinkedIn in the best possible ways. Okay. So there are two things of landing clients. One is inbound. That is, the client will come to you. They will see your works and they will reach out to you. That is inbound. And the other is outbound. That is, you reach out to clients. So both these strategies work, and it is best if you can use a mix of these strategies. However, one thing I want to tell you is that inbound clients are better positioned to hire you. Why? Because inbound client has come to you, right? They come to you seeing your work. They come to you seeing your posts. They have gone through your body of work. They have gone through your posts, what you write about, who you are. They know these basic things. So inbound clients, there are more chances of converting these inbound clients. So keep that in mind. Another is, of course, internships. Internships can be voluntary or they can be paid, like you will be paid a small amount of stipend for that internship opportunity. If you get an internship opportunity, grab it, because there is nothing better than getting an exposure, an industry exposure so vivid. Okay, so try to do that. Then we have freelance platforms. Of course, we have Upwork, we have Fiverr, we have Collabtree. Collabtree is, I think, basically it is for scientists and PhDs. But of course, medical writers can also register and find gigs over there. And then we have job boards like Naukri. We have Indeed. Okay. Then there are personalized job boards also. Creators, there are specific creators who create personalized job boards for freelancers, and they give out these in the form of newsletters or emails. So look out for these kind of things, and if you can reach out to these people and do these kind of things, be active, put in efforts, then of course there will be a time when you will land your first client. Yes, ways to position yourself as the go-to freelancer. So see, today's world is very competitive, to be true. And one of the best ways to keep yourself in your clients' minds is to deliver consistent quality work. That is very important. Quality always wins. Remember this. So one of the best things for you to have as a freelancer is your work ethics. Whether you are responsive, whether you stick to your timelines, your ability to take feedbacks in a positive way, to do the edits in a positive way, to take instructions, okay, to understand what your client is wanting from you, to understand their point of view, to communicate properly, okay. So these are very important things, and work ethics, these things you should have if you are a freelancer. Yes, then of course, as I told you, consistent quality work is very important. Nothing can beat quality work. A client will come back to you again and again for the level of work you are delivering. Then soft skills is also very important. I am telling you this because I was not very good at, reaching out to people and asking for opportunities. I was a very shy kind of person, and I was not very comfortable doing all these things. That was one of my weaknesses. So, and I was losing out on a lot of opportunities as a freelancer because of that. So once I understood this, I started developing my soft skills. I started developing my communicating skills. I am a work in progress. Of course, I am not very good right now also, but I try to, talk with people, to understand their point of view. And because that is the only way forward. You have to talk with your clients. You have to sit down with your clients, talk with your clients, understand what they are trying to say, and you should be easy to work with. Like they should be like, your client should be like, okay, so we have given this work to that person, she will do it, don't worry about it. That should be in their mind. They should not be worried about the work that they have given you, right? So that is another important thing. And the last thing is your social visibility. See, in today's world, if you don't have your social visibility, then you are losing out on a lot of opportunities. And social visibility basically depends on the social media platforms that you are active upon, right? So LinkedIn is one of them. And I always talk about LinkedIn because I love that platform. And there are some steps which you need to do in order to become visible to people. One is like LinkedIn profile optimization. You have to optimize your profile. You have to update your landing page. You have to fill in the experience section, the about me section, your featured section is there, your skills section is there. Then of course you have the headline, the banner, then you have the keywords just below your name. So all these things, the landing page, the profile should be optimized. You have to select some content pillars and formats and stick to that. What I mean is, like today I'm writing about medical writing, tomorrow I'm writing about say gardening, the other day I'm writing about driving. So your clients will be confused, like what message you are trying to convey. Okay, so don't do that. Find out 3 or 5 areas. I say 3 areas. Okay, find out 3 areas you want to talk about in your LinkedIn, and always keep posting about those areas only, about those things only. That way your clients will find you better, they will find you faster. Okay. Okay, sir. So how to build a sustainable career as a freelance medical writer? See, there is importance in the word sustainable over here, because not all freelancers who start their career uh, turn into or grow into a profitable and sustainable career. So the word sustainable is very important. Uh, I will tell you about some phases that comes in everybody's life. It has come in my life. I'm sure it has come in Sir's life also, and it will come in your life also as a freelancer. First is the starting phase, when you start off working, right? So you can start work like say within 3 months, or you can get work after say 6 months, 1 year. So it can be slow or it can be fast. Okay, you can be working with a single client and rates may be low. So, and because you don't have any other opportunity, you are sticking to this. So that is the starting phase. You are starting gradually. After that comes a growth phase, when you are trying to grow. And what happens is, during this phase you will be overwhelmed with work. You will be working with multiple clients. You will be getting more clients. So like this will be the best phase of your freelancing career. Then a time comes when everything feels okay and fine, and you are very high on your growth phase. Then a time comes when it can plateau, like you no longer like your work, you are not growing as a freelancer, you are not seeing the money grow. So these things can happen. I'm not saying these will happen, but these things can happen. Now, from where you go forward depends on this phase. See, there are many people who quit in this phase, who say that, okay, so I'm not crafted to be a freelancer and that's it, I'm quitting. Okay. And then there are people who work upon themselves and they come back, right? So how do you work on themselves? How do they work on themselves? See, you have to analyze yourself. You have to analyze your strengths, your weaknesses. Like I do a SWOT analysis. SWOT analysis is a strength, weakness, opportunity, and threat analysis. Okay. And every 6 months, I try to turn one of my weaknesses into my strengths. I'm not always successful, but I try. I identify my weaknesses and I try to work upon it. That is very important. You have to self analyze yourself. What made you do some mistakes? What were the mistakes you made? Okay. What are you not liking? Okay. Where do you see yourself 5 years from now? These are some of the questions you need to ask. So learn from your mistakes, reassess and introspect. Okay. Try to understand yourself. Where do you see yourself 5 years from now? Then upskill, evaluate and upskill. And if you feel that you want to pivot, you want to redirect the way you are growing, you are not liking it, you want to pivot, this is the chance for you to pivot. Okay. So do that. And of course, focusing on your strengths and trying to build upon your weaknesses. That is very important. Another thing that I have faced in my initial days was that I worked alone. And I was trying to do a lot of things together. I was juggling between everything. And that took a toll on my health. So don't do that. Try to build a team and you delegate tasks. Okay. Don't overwhelm or burn yourself out. Don't do that. Try to take these things one at a time, slow down and build a team. And that all these things, when they come together, they lead to a sustainable career. So there's a lot of work to do over here. And if you are ready to do all these things, then I think you will shine. Yes, coming to the pricing strategies. See, pricing strategies are very diverse. As a freelancer, you will be working per word, you will be working per project, per hour. So these are three common pricing strategies. Now, see, per project is the best kind of pricing strategy that I think we have. Because when we uh, price per project, we are taking in our expertise, we are taking in our time of work, our hours of work, and researching, reading, all those hours we are putting into that pricing strategy. Okay, and then we are calculating how much amount we can charge for that particular project. But when it comes to per word, like say I'm writing a 500 words article blog, and I am charging say 2000 rupees for it. So you are not taking into account your time for researching for that topic, right? You are just putting in words, and depending on the number of words, you are pricing yourself. So that is a disadvantage of per word pricing. Again, per hour, that is I don't believe in per hour pricing, because what happens is when you are an expert, you are able to draft out a write up faster. Okay, and if somebody is not an expert in a particular area, then they will take say many more hours than you take, right? So they will be getting more amount of money than you for that particular project, but that is not right. So in per hour pricing, I don't believe in this. Per project and per word pricing, of course they exist, and depending on where you are in your freelancing stage, you need to understand which pricing strategy is best for you. And we have some key questions. Like, these questions are important to understand which pricing strategy will go for. See, one is like, what is the objective of the work you are doing? Okay. Who are the target audience? What are the deliverable details? Like whether they are blogs, whether you need to put references, whether they are more technical documents like white papers. Okay. What are the number of documents you will be delivering per month? Okay, so all these things, whether there is a need for on page SEO or not, so these are factors that sum up your pricing strategy. And whenever you are able to answer all these questions, you give the client all these questions actually, and they will answer these questions for you. You have those sheets, and then you decide which pricing strategy is best for you. Yes, this is something that we miss out on. Like, one is we don't understand our legal obligations as a freelancer, and we don't. Most of us don't have contracts also, and that is very risky. So freelancing contract is very important. Try to keep it in place. Try to, if you don't understand what contracts are all about, don't worry. Just contact a lawyer, and you can get a contract done. Okay. Also, there are templates available. I think there are templates in Google Docs also. You can find some templates. You can check them out. And another thing is, if you are working with big clients, probably they will give you a contract. They will have a contract already done for you, and they will share it with you. So before you sign that contract, you need to understand every word in that contract. Don't make the mistake of just signing it, because you don't know what you are getting yourself into. Okay, important things to consider. See, first of all, the primary scope of work. Like, what is the format of the deliverable? What is the number of articles you will be writing per month? Okay, everything should be in written context. No word of mouth. Word of mouth doesn't work. Okay, then of course the proposed timeline, or the deadline as we say. Then we have the rates. What is the agreed rate? That has to be written down. Then payment terms. Terms means whether that client will pay 50% upfront, or full upfront, or they will pay once you have submitted. What is the payment terms? That is important. Associated work scope. Now see, associated work scope basically means how much you will stretch yourself, to provide for that client. Like whether you will be doing 2 revisions, you will be doing 3 revisions, 4 revisions, whatever. So all these things needs to be included in that contract. And NDA is very important. Like sir said, NDA is very important. Check for your non-disclosure agreement. If there is a non-disclosure agreement, then you will not be able to share your works with other clients. You will not be able to include them in your portfolio. So remember that. Another important thing is non-compete. See, there are certain contracts which will restrict you from working with their competitors. Okay, so if you are taking in work from a particular client, you will not be able to take work from other clients who are working in the same space, who are their competitors. Keep that in mind. And whenever you have a doubt, of course, try to contact a lawyer and have a lawyer read the whole draft, and then you sign it. Yes, so I think we are in the last slide. So 5 lessons I have learned from my freelancing journey. One is communication is key. See, if you can't communicate properly, if you can't talk to the client properly, you will not be able to understand what the client wants, right? And oftentimes, what happens is that clients are not very clear with what they want, and they rely upon you to find a direction. Okay, so that is where your communicative skills will take center stage. So you need to be apt with communication. Second is your clients are the most important thing over here. Your clients, whatever they are trying to relay to you, whatever their message is, whatever feedback they are giving, try to take everything very seriously, and try to incorporate those things into your writing. Because if you don't get a client satisfied, probably you will be missing out the next opportunity. Because word of mouth works over here. Your uh, existing client will refer you to a new client. Okay, so that happens. So keep your clients in mind whenever you are writing. Okay, be a responsible person, take up calls. Okay, and give responses, email them when, if you think that you are not understanding a particular aspect and you need some kind of insight, talk to them. Okay, so that is important. Be a responsible person, never ghost them, don't do that. And don't burn out. You have to create a healthy boundary. You have to understand that you cannot be working 24 hours a day, and you have your hours of work. And all these things, try to talk to your client about all these things and make it clear between you. Let it be transparent. Okay, and develop a business mindset. That is important. See, 9 to 5 jobs are, we are going to the job place, we are doing our work, we are coming back, we have no other responsibility. But freelancing is your brainchild, right? It's like your baby. So you have to work towards it. Everything, every little effort counts, and you have to put up every little effort. And of course, you have to keep upskilling yourself. That is very important. And whenever you are in doubt, ask for help. Now, initially I was very shy to reach out to people, as I told you, and I was like, how can I ask that person about this thing? I don't know about this thing. So don't do that. If you think that you don't know something and you want help, you want some insight about a particular thing, then go ahead and ask for help. Most of the people will help you out. So don't think twice. So I think with that, we have come to the end of the last slide.
Yes,
Thank you,
perfect.
everybody.
Thank you, Dr. Satabdi.
Thank you, sir.
Perfect. It was great. And I think you gave a complete overview of how the whole freelance works, right? Participants, a kind request to you. How do you feel about this presentation? Please put in one word in the chat box. Let's see how you feel about it. One word to describe the whole presentation of 1 hour. Am I asking too much? Let's see. Okay. So Yogesh is good. It was awesome, excellent, insightful, very informative. Informative again, great, knowledgeable, informative. All right, great, informative, straight from heart. All right, that was a good one. Thank you, Dr. Narhari, for that. Future money, DP, empowering, practical, give clarity, helpful, insightful. All right, you see, Dr. Satabdi, so many of our participants, they actually like the whole presentation, right? And I'm sure this whole presentation gave them a overview of how the entire freelance industry works and how they dive deeper into freelance, right? So as usual, we'll take up a lot of questions, but depending on how they want to ask, right? So there is a rule. If you want to ask questions, you have to raise your virtual hand on Zoom. I'll unmute you and then you can ask the question. If you're watching you are watching us on YouTube, then you have to put the question in the chat box and I'll read the question for you. Dinesh on YouTube says, mind blowing. Thank you, Dinesh, for joining on YouTube. Dinesh normally does not miss any of these webinars. I've seen him for past almost 3 years, attending almost every webinar. All right, so thank you, Dinesh, for being a lifelong learner. All right, so there are some questions I'll start taking on this from the chat box, and all of you who want to ask the question directly to Dr. Satabdi, I encourage you to normally ask, right? Because that is how we get connected here. So please ask by raising your virtual hand on Zoom. I'll unmute you and then you ask the question. If you want, you can switch on the video and audio both, or simply you can switch on the audio and ask the question. All right. So let's read one of the questions from Surjikar Chinmay. Before going for freelancing medical writing, should we go for an experience like an internship, or what do you suggest for someone who's doing MPharm and wants to get started as a medical writer in freelance, as a freelance medical writer? Dr. Shatabdi, want to say something, or?
I think freelancing will give you a very good exposure of the industry. It's a very good question, in fact. And if you can get a freelancing opportunity, like I said, just grab it. Nothing like it. And because it will give you on-the-job experience, you will learn on the job. And medical writing, whatever I say, makes no sense if you are not doing the practicals, if you are not doing the writing. So if you have the opportunity, of course, it's a very good thing.
Perfect. Yeah. So, okay. Dharmpal, welcome. Good evening. You can also switch on the video if you want to, and you can talk. Dharmpal has been into medical writing. He has been my college senior, and he is also into regulatory medical writing nowadays. Welcome, Dharmpal. How are you doing?
Yeah, I'm good, Manoj. Thank you. So I just wanted to answer that question on medical writing freelance. Freelance, you can start anytime, but only thing is you should have adequate knowledge, understand whether it fits you or not. Just because it is free, you cannot join and you cannot mint money, because you should have a flair for it, have interest. As Madam told, you should have interest in learning every day, reading every day, researching every day. Because if you are in industry, you will have some support system. When you are doing freelancing, it is not only that you are a medical writer, you should sell yourself, sales part is yourself, business development is yourself, invoicing is yourself, keeping an account of whether the payment has come or no, and what are the terms for payment. All those things are yours. So it is like, once you are doing freelance, it's nothing but you're an entrepreneur. You should ensure that you have end to end of it to understand it goes successfully. Second part, freelance is like a twin edge. If you have not done your groundwork and start doing freelance, with one or two projects, you will understand the difficulty, you will understand that it is challenging. There are all chances that you can quit medical writing because of the difficulties or because of the challenges you face. But on the other hand, if you understand what challenges you will face, what are the requirements for a freelance medical writer, whom you have to approach, and which are the first projects you need to take, if you understand all these and go step by step, then you like it and you enjoy and you can relish as a freelance medical writer.
Thank you so much, sir, for your insights. Absolutely.
Absolutely, yes. So basically, we need some kind of experience to get started as a freelancer, right? And some of the pharma's clients I know, they also give internship opportunities wherein you learn from them and then they absorb you as a consultant or a freelancer. All right, especially the medico marketing companies or the pharma marketing companies, because they don't want to hire somebody on a full pay or full role. They just want to hire outsourced project to project basis. They want to pay you on a retainership basis so that whenever they want, you are available for them. All right. Thank you, DP, for, I call him DP, Dharmpal, DP. So for putting those notes, and it was great. Thank you. Next question is from Levis. Can we start freelancing while doing MPharm along with studies? Is it possible to balance? It totally depends on you, Lewis. All right. So I know some of the MPharm students who have written projects, who have published scientific research papers, and they've also worked with some of the pharma marketing companies. So it is totally dependent on you. Okay. Anisha, do pharma companies entertain freelancers contacting them individual, or they prefer outsourcing to agencies? We'll take perspectives from both Dr. Satabdi and Dharmpal on this.
Can I have the question once more, sir?
The question is, do pharma companies entertain freelance writers contacting them individually, or they prefer outsourcing it to agencies?
Sir, I think that's a question we need to have some context about. Like, whatever is in my experience, I have seen that there is a slight preference for outsourcing to agencies.
Yeah.
For freelancers, I don't know, but I think there is some preference where they actually prefer to give it out to agencies because they have some kind of accountability over there.
Yes.
Freelancers always have that. They can leave, they can host, they can leave in the mid of a project, and things like that can happen. So to have some amount of accountability, I think there is a slight preference towards agencies.
Absolutely. What about you, DP? Would you want to give some perspective on this?
Yeah, according to me, it has both. As myself, as I'm heading the medical writing team, I prefer both the agencies as well as individual consultants. That depends on what is the rapport we have, what the understanding we have with the consultant or the freelance writer. If I know the freelance writer's ability and the what do you call the etiquettes with regards to timelines, quality, approach, based on that, I give the project, whether it can be a consultant or it can be a agency. But preferred one is agency, because with agency, we'll have some backup. Once we give it to agency, it is not one person who will be working. There'll be multiple people. Second, if a person who is working on the project leaves, there'll be a backup or somebody will be there to handle it and ensure that timely delivery is there.
Absolutely. Absolutely right. But I have a different thought here, because I have worked in both the scenarios. I have worked with the pharmaceutical domain. I have also worked as a freelancer. I've also worked in the agency setup. So what I have seen in Indian context specifically, the bigger clients, they prefer to go with agencies, no doubt about it, right? But the smaller clients and those companies which are just starting up, they don't want to go with agencies because of cost. That's number one point. They prefer to have somebody who can come at their office. They can work with them for some time, let's say weekly, once or twice, or they can work on a consultancy basis, right? This is especially for the smaller companies or those companies which are just starting up. And bigger companies, obviously, they want to go with the agencies, right? All right, this is my experience. All right. So let's take some other questions. Do we get remote internship opportunities? Very rarely. But yes, nowadays the world is opening up, and then you have possibilities of getting, yes, a lot of opportunities.
But learning is limited with remote.
Learning is very limited. I totally agree with you. The kind of learning we get at the office setup, that learning nowhere happens at the remote setup. Okay, can we get access to few medical writing sample content drafts? Avinash, very difficult to say this, because in majority of the cases, even freelancers, agency setup, we are bound with the NDA, right? So we are not supposed to share any of the content that we write for the pharmaceutical companies, doctors, or healthcare professionals. But those blogs that you find on the websites are generally written by either freelancers or full-time writers. So if you find any blogs on the websites of these pharmaceutical companies or marketing companies, you know that those are the samples which are written by some of the medical writers. So you can connect with me later on. I'll share some of the drafts for you. Okay. All right. DP and Dr. Satabdi, you want to give some perspectives on this?
Yeah, you can Google on some of the specific terms, you will get some. But again, as Manoj told, most of them, it will be confidential and conflict of interest. It will not be shared on.
It will not be, yes.
Just like that.
Absolutely. All right. So there is.
But I think you have summed up the whole thing.
Thank you. There is another one from Kavita. How to switch domain? I am a drug safety professional. All right. So who wants to take this?
Okay, so how to switch domain? Like you are a drug safety. She's a drug safety
Professional,
right? So she's in the regulatory field, and she wants to move into the communications field. Is it is that what she's asking?
Yeah, she wants to get into medical writing.
Medical writing. Okay, so if you think that you want to switch, first of all, you should know why you want to switch. What is the goal that you have in your mind? Like, why is it you are not aligned with what you are doing right now? Is it that you want to try something new? Is it the monetary aspect? What it is? Why do you want to switch? If you are clear about that, then I think the rest of the steps will follow.
All right.
Can I, Manoj?
Please.
Yeah, I am your live example who's being switching from different fields. Initially, I started with regulatory medical writing, followed by promotional medical writing. Then I switched to drug safety. Now I'm managing regulatory medical writing, drug safety, and publishing part of it, and part of scientific writing. So I can understand what is her name, Manoj?
Kavita Mishra.
Yeah, Kavita. Maybe she is from ISCR background. Sorry, ICSR, individual case safety reporting. I can understand her situation mainly because of the targets, daily workload. So she wants to switch the domain, and any domain you go, medical writing, safety writing, ICSR, targets will be there, and you will have some timelines. Only thing is how you can, from your experience, how you can expertise and align your skill set to improve yourself is more important. And definitely drug safety has a lot of obligations where timeline is an important aspect. Compared to that, medical writing is always a better domain.
Kavita, can we have Kavita online? Kavita, you want to ask the question directly?
Yeah, yes. Thank you everyone for answering. So basically, I am working in ICSR and I am into operations, and I have never been into the writing part, but it interests me so much, and I want to move into the freelancing besides that a fixed hour job. So that's why I asked this question.
Yeah, easiest way to switch from drug safety, you can move to aggregate reporting, where you can correlate your safety knowledge as well as you can ensure that you are writing something scientifically. Once you join this aggregate reporting, or you start working on aggregate reports, then it's easy for you to switch to medical writing. It can be content development or regulatory or scientific.
Okay, thank you so much.
Perfect. Thank you, Kavita, for that question, and thank you, DP and Dr. Satabdi, for your perspectives. Thank you so much. All right, so let's take some other question. All right, this is from Chinmay. What kind of domain knowledge updation we need as a medical writer to sustain? Now, we already have discussed, but again, DP and Satabdi, both of you can answer this.
So the basic medical knowledge, that the terminologies, how the drugs work, what are the mechanism of actions of the drugs, the pathophysiologies of the diseases, how diseases happen, and the basics of treatment. So all these things you will not, if you are not from the medical fraternity, it can become a bit overwhelming initially. But this basic medical knowledge is important to understand or align with your project. because you will be working on a variety of topics as a medical writer. And so that is one thing, basic medical knowledge. Then, of course, the basics of your writing, like your grammars, your readability, whether the amount of technical words you are using, whether that is appropriate, or whether you need to loosen up your writing a bit to make it easy. So that understanding, you need that understanding. And these are the basic things that you will need. Another thing you need is some amount of data analytical skills, like you see some p values, some statistics, and you are able to translate that knowledge into words, into relevant words, so that people can understand. So that is another thing that you need to grasp upon. And of course, like I said, communication and all those things, soft skills are important, but they will gradually happen. So I think that's from my experience.
DP, you want to add something? Thank you, Dr. Satabdi.
As Madam said, medical writing is all about having medical knowledge, second, having flair to writing. If these two are taken care, then next step is what kind of writing you want to do. Whether it is educational material, regulatory writing, scientific writing, or promotional material. Based on that, you need to upscale yourself. Simple example, if you want to upgrade yourself or if you want to get into scientific writing, start reading the articles. You will understand how they are writing, what is the flow they are following, what kind of language, what kind of terminologies they are using. Then second thing is upgrade yourself with regards to statistics, like how to interpret a graph, how to interpret say hazard ratio. If an hazard ratio is given as 0.55, so with this, what is your interpretation in terms of how can you give this in terms of what do you call communication to the layman? How best you can give it. So like that, you need to understand what is your domain. Once you set that, then if it is a regulatory writing, upgrade yourself with the guidelines. Every day guidelines comes up, new guidelines, there is updates, and always understand what are the regulatory guidelines as well as treatment guidelines, consensus statements, expert statements. So all these, if you understand, then you yourself will upgrade yourself. For a medical writer, basic thing is you need to read every day, you need to write every day. Only then you will be able to upscale yourself and understand where you are.
Absolutely. I think that's the most important thing, the interest to read and write. Once we have that, the rest of the things, the experience automatically teaches. I got into medical writing by chance. It was not a choice. By chance, I got into. And I got into scientific writing, and nowhere the subject, the master's which I was doing was pharmacognosy, which is related to herbal drugs, was related to medical writing. It was nowhere related, right? But when I got into scientific writing, it slowly, gave me options to learn more about the subjects, different topics, the different therapy areas. And over a period of time, I dived deeper and deeper into different subjects and learned a lot of them. But then it's a non-stop process, right? The learning never stops. Every day when we write on new projects, on a new topic, it's a new learning altogether. I can never say in my life that I have known any of these topics perfectly. No ways. Whenever I read an article, I feel that, okay, there is something that I have missed out, right? Every time I read this, it happens to me. Right now, I'm working on a manuscript and it is still happening to me, right? It has come for the second time for review. And again, second time when I'm reading, I thought, okay, there is something which I missed in the reference, right? It happens all the time. And learning is continuous process, and you don't need to be an expert in any of the therapy areas. All you need is the interest to read more, write more, understand more, and continue this whole cycle forever. All right.
Are important.
Absolutely. Thank you. All right. So thank you, DP and Dr. Satabdi. So next question is from Trinath. I'm a CRC now, and I am switching to clinical SAS field soon, but I have some experience in medical systematic review and many research paper and published it. But being in SAS domain, how can I select a niche? Yeah, this is something which both of you can answer.
So I think software as a service. So he is trying to switch to a SaaS field. Uh, so the most important thing is what is the kind of information that goes into building that software, that is important. He needs to understand that, and before switching, because otherwise he will not be able to be a part of why that whole thing was even why that thing even came up, right? So a basic understanding of how these things work, that is important before he switches the field. And after that, yes, promoting medico marketing also forms a very important part over here, because often these softwares or these products needs to be marketed properly. So that is another important thing that needs to be he needs to understand the medico marketing part also. So I think these two things are most important.
DP, your perspective, you have almost seen all these fields.
Yeah, my understanding is, first of all, is switching his domain to SaaS, and SaaS has its own requirements where it can be statistical output of the data, or it can be software where you need to plug in some basic information about medicine and other data related to medicine and get an output. So always your research articles and meta-analysis experience will help you, but it depends on how you want to leverage this knowledge into SaaS.
Perfect. I think another thing is, because he has been into CRC and switching to clinical SaaS, there is something that comes in between, like clinical writing and publication writing is part of both. So he could just give a try in both of these types of writing, and I'm sure he finds the niche in one of them.
But he should not put his hands on multiple things at a time and spoil his SaaS career also.
That never should be. See, I always tell to try something where your expertise is already. So for example, you have an expertise in CRC. So try something which is related to clinical research, clinical writing, and publication writing, because you already have that expertise of CRC, right? Don't try to get in a totally new field. Already, whatever your expertise is or experience is, try to create that into a niche. That will help you a lot. All right, perfect. So I think we have completed all the questions. All right, Dr. Bhugna, thank you so much. I'm glad that we answered the questions. All right, so let me just check if there are some questions on YouTube. All right, so one question I think we get most often is, do we need a certification course in medical writing? Who wants to answer this?
Sir, I think you are best in a best position to answer this question.
No, let's have the perspectives from DP and you both. Based on your experience, let's have that understanding.
Sir, I think I'll go first. I think that courses are not mandatory. It's not that I will not say different people come with different academic, expertise. And I think if you are aligned with the field that you are approaching initially, then you can go ahead with it. Like I will give you an example. I have, not only I, whoever has done their MDS or masters, we have written our thesis, whatever field it is, right? We have some amount of knowledge in our academic writing, publications. We have published papers. So we come with a minimum level of expertise in that. And I think initially it's important that we leverage that into our into how we can draft better papers, in how we can use that in medical communications or any other field that we go. So actually, it depends on the skill sets or the expertise that the person is coming with, and the kind of project that the person is planning to work in. If there is a particular requirement for a project that I do not know, I do not have that skill, then obviously, if there is a course that gives me those skills, I will go for it before I take up that project, before I even approach a client who specializes in those kind of things. So again, it actually depends.
All right. DP, your perspective. Thank you, Dr. Satabdi. Let's go for DP.
Thank you.
DP, your video is frozen.
If I'm joining, sorry, am I audible?
Now you're audible. Yes, you're back.
So there are two perspectives to it. So if I'm joining the industry as a full-time employee, then I don't prefer a certification course. But when I am going for a freelance opportunity, definitely at the initial stages, I need to prove, I need to assure the client that I have enough capabilities. So the certification course will be one of the credentials of my abilities. Second, the approach and the way I go to the client, even my CV, everything will give exact idea about myself, whether I have actually done the course and whether I am suitable for the what do you call project which they want to give. Because just doing a course and having nothing, no knowledge in me will not help me. So you should have adequate knowledge. Along with that, if this certification, with this certification, it helps me to prove my credentials. So I definitely agree that for freelance, at the initial stages, yes, certification will definitely help. It will give additional credentials to your abilities.
Absolutely. Thank you, DP, for that.
Manoj sir, yeah,
Yeah.
Manoj sir, I would like to add one thing. Like sir said, if we actually learn, if you are learning on the job, we have an internship opportunity, or we have some kind of opportunity where we are learning about the industry while we are on the job, then that is the best kind of, I think, experience that a freelancer can initially have before we start freelancing. Because once we become a freelancer, we try to become a freelancer, what happens is we become independent contractors. There is nobody to teach us anything. We have to come with that knowledge, with that skill. The client expects that from us. So that is where these courses, certifications, and or whether we are learning on the job, that comes in. And some sort of skill sets needs to be aligned before we start freelancing, because we can't go and ask a client that I don't know what this is and I need insights from you. That doesn't happen.
Absolutely. So, as I told, I have seen the, first half of my life as in an agency setup where I worked on medical marketing and scientific writing. And when we got into, not just me, I DP, and there are many who got into scientific writing almost at the same time. We all started the journey together, and we had no idea what this field is all about, right? During our times, there were no courses, there were no certifications, there were nothing else except for our managers, who taught us in a very hard way or the soft way, depending on which company we worked with. And we learned a lot from these guys who were
Managers
experts.
and clients as well.
Yeah, of course. And of course, the bombardments from those clients, yeah, who were never satisfied with the kind of work we used to do. So they taught us in a very hard way, and we learned through our experiences. Now, these experiences, no certification can beat, right? And I have seen a lot of companies which are issuing advanced diploma course in medical writing, pharmacovigilance, and then 10 other things together. So when the person comes with a certificate, you know that he's certified in medical writing, clinical science, pharmacovigilance, and even medical affairs. Okay. And then when you start asking some questions related to medical writing, or even if you give him a task to write, right, he just can't do it, right? He's not able to do it. He or she is not able to do it. And I've seen this with not just one, maybe 15, 20, 30 medical writers who got certifications from different institutes. So what I'm trying to say here is, try to identify your gaps in the knowledge and try to figure out the course or the YouTube videos. Probably YouTube has the best opportunities and options today, which are completely free. And try to upskill yourself to bridge the gap. That's the first thing you should do, rather than going for a full-time certification and paying maybe few lakhs of rupees on these certifications and knowing nothing, right? And when you go, and this session is all about freelance, so I'll stick to that here. Let's say if I project myself as a medical writer and I reach out to a client, the first thing the client is going to ask me is, give me some sample works that you have done. That's the only thing he's going to ask. He's not going to ask me, whether I have, done the XYZ things for different companies or not, and all the background that I have. All he wants to know is my background, that is my educational background, the skills that I have with me, and the deliverable that the client is looking for. If I'm able to do that, then the client, next question the client is going to ask me is, give me some sample work. Or he might even ask me to create a sample work for him for a product of his, or maybe a therapy area for him, right? And that one project itself is the deciding factor whether I get the project from him or not. And not just that, if the client feels that I have not justified the work, he'll tell 10 more clients in the field, and I get my door gets shut for all the 10 clients right from there, right? And this is not just one time it has happened. It has happened to multiple people, I have seen in the domain, and this keeps happening every day. So what is the way out? The way out is very simple. You know that the clients need this kind of works, that if you go to my YouTube channel, for example, even DP's video is there. He talks about pharmacovigilance and what happens there, and we have 30 hours of content on medical writing alone. So when you watch these videos, you'll get an idea of what is the kind of expectations the client have, and then see whether you have those skills or not. So basically, I'm asking you to do a SWOT analysis for yourself, right? When you do a SWOT analysis for yourself, you know that, okay, you have those skills and you are missing certain skills. Now see how you can upgrade or upskill yourself and level up to that requirement. Then next step is to write some sample articles. Now, when you go online and search for any of these therapy areas or medical marketing or regulatory medical writing, you will have thousands and thousands of blogs available, right? So see if you can write on any one topic from scratch without depending on these chat GPTs and all these, artificial intelligence tools. Because today, even the plagiarism has an option to detect the plagiarism through these chat GPTs, and clients have access to them. What access you have, I have, the clients also have the same access. So we cannot deny that. So create some sample articles for yourself and publish them on Medium, LinkedIn. LinkedIn has also given this article writing for free, right? And just in case you don't know, please check out that past video which I did on LinkedIn, and then it details almost everything there. So you can write for free there. Take a 30 days time, take a break from all of that for 30 days, brush up your knowledge, and then write few articles. Now, how to upskill? There are a lot of free resources. One resource is Swayam portal, which is Government of India's portal. It has videos on communication skills, scientific writing, research, and almost everything. Okay, there are more than 4,000 plus courses which are available for free. So please register, learn from those videos at your own pace, and upskill. Option number one. If you're looking specifically for scientific writing, there is one on Coursera also. So watch that video and you'll be able to understand what kind of skills they need, right? So with this, I think you have the skills.
Points, Manoj?
Please.
Yeah, as you told, I just wanted to stress on 2 points, because if at all people are fresh in this forum and they want to get into freelance, just one simple tip I want to give. With your initial discussions or conversation with the client, most of the impression you have already built in. So for simple example, I tell you, what is your qualification? As soon as the person says, I have done M Pharmacy, drop. I'll not consider that person also, because the course name is first of all not M Pharmacy. It is M Pharm or M Pharma.
Absolutely.
Okay? And after doing 4 years of B Pharm, 2 years of M Pharm, if the person doesn't know what is the course name correctly, then how are you sure that you are giving the project to the correct person? Point number one. Correct. Point number two, can you brief yourself? Sir, I am a hard worker. Boss, I don't want hard workers. We have seen enough of hard workers. We want smart workers.
Exactly.
So they try to impress with these jargons, which are not useful actually in the current era. Absolutely. Now, nobody wants hard workers. We are not here to lift bricks and cement blocks for 2 to 3 floors, right? We want smart workers, understand interpretation, manage time, maintain timelines. Those are the things which are important. But people are still in a problem with the current pharma professionals is they don't have their innate nature to build in or to put it in paper. They just try to copy from somebody, copy from some CV, which is actually not their skill set or etiquettes. And third point, which I want to stress is, whenever you're going to client, understand, once you get the requirement, understand the requirement in all directions, try to cut it into pieces and see where all you will have gaps, then ask right questions. Always ask right questions and take clarity before jumping into projects. What happens with freelancers, especially with my experiences, they'll not ask right questions. Whatever you say, they'll nod your head. They go, they start working on the project. After 3 days, just before the day of the delivery, they come up with the question that, is it this, is it that, so we can align. But that is not the time to ask questions. If that question, if that groundwork is done earlier, then it would be easier for you also, and it will give confidence for the client also to ensure that the project is gone to right hands and they'll get the right delivery.
Absolutely, 100%. Totally agree with that. Thank you, DP, for those perspectives. And regarding the degrees, right? You have just now told. I had posted this, I think 2 years back on LinkedIn, and it got about 23,000 people saw that post regarding the degrees. And still, if you see, not many of them have updated their degrees, which is a very sad part. This does not happen in other, areas. It happens mostly in pharmacy. Most of the pharmacy professionals, they feel that they know everything, but they know nothing. That includes me also. I'm not an exception here, but that includes me as well. All right, so we'll take one last question from Aparna. Aparna, you can please unmute and ask. Aparna KS, please unmute. If you're there, please unmute.
Good evening, everyone. Sir, as ma'am mentioned that we can start as a voluntary contributor, right? So how should we start? Or what are the mediums for being that other than LinkedIn?
Medium itself is a medium. Okay.
Okay, thank you, sir.
Medium is there. Then you can also reach out to a lot of pharmaceutical companies. If you just go and visit their website, there is a blog section, right, in most of them. And let's say you are interested in writing on some of the topics and you feel that they have not updated the blog or they have not written it. So you can reach out to them, and in 99% of the cases, when the client is getting this article for free, he'll say, okay, go ahead and write and give it to me. Okay, you can write there. There is another.
Okay. Yes, sir, please go ahead.
So there is another, especially if you're a pharmacy professional, there is another publication that happens every week, which is called as Chemical Weekly. It gets published from Hyderabad. Check out that, chemicalweekly.com. And this is a newsletter that gets published every week, and they publish on different APIs and pharmaceutical products and all of that, and also therapy areas. So if you're interested, you can also write an article for them, and they publish it for free almost all the time. Okay. So do reach out to them, and in case you're not able to find the contacts, just let me know. I'll share the details with you, and then you can reach out to them.
Just one small change. Before reaching out to the companies, write 1 or 2 blogs, post it in LinkedIn, you'll automatically get visibility. Exactly. Then you approach, you'll have weightage.
Yeah, because I was about to tell you the same thing. Before reaching to any clients, ensure that you have written at least few different types of articles. When I say few different types, they can be a blog, that can be a, let's say, short review, that can be a, let's say, drug profile, that can be a patient education for a disease, for example, diabetes, or hypertension, or cancer, for example, breast cancer, anything, right? Because
it can be anything, even freelance. Write a brief on freelance, but once you start writing, you will understand how many times you get caught, how many times you get stuck. So that shows your abilities, whether you're fit or no, you can justify yourself.
Absolutely. So writing is the easiest way to get started. There is no shortcut to it. Okay. And
sir, I would like to add one thing.
Please.
Yes, sir. Actually, in Medium also, they accept, there are publications that accept, write-ups like health blogs, or so if we are writing on Medium, then there are third-party publications with whom you can publish your work. They can be blogs, they can be related to freelancing also, healthcare field, or a particular disease if you are wanting to write. So, of course, they will check the quality of your work. There are editors working with them. So that's an advantage that they have good editors working, and they will edit the work and you can submit it, and they will publish it for you. You will get a URL link also, and that you can share in your portfolio also. So that is another way of getting a voluntary contribution.
Absolutely.
Thank you,
So, okay, thank you, Aparna, for asking that question, and thank you everyone for responding. Dharmpal and Shatabdi. One last question is from Dr. Nikita from YouTube, and the question is, what a portfolio should contain? Should it be only blog or scientific writing, or just by doing this, can I call myself as a medical writer? So I want perspective from all of you. From Dr. Shatabdi and DP, both of you.
Okay, sir, I think like even what I do is I'll talk from my experience. When I approach a client, and if I find that that particular client has a particular area of work that he wants to for which he wants to hire me or work with me, then I try to update my portfolio in such a way that there are at least relevant samples in the portfolio for him to see, so that he can understand my expertise, if, whether I'm fit, whether we are fit to work together. So I don't share the same portfolio with every client that I approach, or whoever approach. Whenever a client approaches me, I try to keep it relevant and update it from time to time, depending on the work for which that person is reaching out to me.
Absolutely. And the portfolio does not mean only one type of article. It simply means that what is the type of article you are trying to get from the client? Because when you reach out to the client will ask, okay, show me what work you have done. So you need to showcase such articles which you want to write. Okay. It starts right from your short introduction, because many times, most of the writers, for example, they don't have a short introduction. When the client says, okay, send me a short profile of yours, they simply send their resume. It doesn't work out, right? You need to write a 4 lines or 5 lines about you. And how do you check that information? Go to WebMD or Medscape, for example, where doctors and pharmacists write content, right? So where if you see the author's details, they would have written about the author. You get that information from there. And if you go to Medscape and WebMD, you can also check the kind of articles you can publish. See what kind of article you are interested. If you want to see the variety of articles, you can also go to PubMed, for example. Search on any topic, you'll find review article, you'll find original research, you'll find mini review article, you'll find systematic review, you'll find case studies, you'll find about 6-7 different types of articles you'll find straight on PubMed itself. And you can filter, read one of these and see if that writing aligns with your type of interest, right? And then create small articles. You don't have to create 15, 20 pages, 30 pages articles. Just restrict yourself to creating at least 3-4 pages article max, and follow all the guidelines. What do I mean by guideline? Referencing, outline, formatting, headings and subheadings. These are some of the basic guidelines we need. Caption, copyrights, plagiarism, right? These are some of the basic things that we need. And if you're able to maintain that portfolio for yourself, and you maintain a zip folder, for example, or if you are published online on Medium or LinkedIn. LinkedIn is the best option for you to publish right now. There is an article writing option on LinkedIn. You simply publish, send that link to, let's say, 100 friends of yours, and ask them to go and give their comments and like the article, right? So that way you create that social proof, which is very much needed today, right? When the client reads that article, he'll say, okay, there is 100 like on the article, and say, okay, this article must be a good one, right? So create that social proof for yourself, and you are responsible for your work, as simple as that, right? You can also develop a basic website. Today, it does not cost much, and you can do that as well, right? So I think this helps. We have overshot the time anyways, but I hope it was valuable session. And
can I add a point to this?
Please, DP. Yes, we'll take that as a last one.
I have a different approach for this. You write a 1 to 2 pages article about whichever topic you want to write.
Yeah.
Then how you see how you can align this into different deliverables. Say
Absolutely.
you have written a two-page review article. From this, you make a leaflet. You prepare a graph out of it. how you can present it numerically or statistically. You prepare educational material out of it. You prepare a lay language summary of it, or you prepare a one-pager, so what do you call the graphical, or a slide deck out of it. So same material, how you can present it in different ways. You have it in your portfolio, show it to the client. You want this, I have it. But for the same data I have done in different ways, this is what is my capability. With that, any client will be able to take up your
excellent point. Excellent point. I totally.
It's a very good approach. Very good approach.
A very good approach. Yes. So the whole point is, if you want to become a freelancer, create a portfolio for yourself. How do you create a portfolio? Just now we summarized. DP has summarized that. So create an article of your interest of about 2 pages. Now go and see the different types of input the pharmaceutical companies need. The pharmaceutical companies mostly need a visual aid, an infographic, or a poster, or a mini review article, or a blog. So convert the same article into different formats and publish them in different platforms, like, for example, LinkedIn or Medium, or there are other platforms as well, right? So when you publish them and when the client reaches out to you, showcase the articles to them. Tell them that this one topic can be converted to n number of formats. Right now, as in medical writing, what we do normally when the client reaches us, we ask them, is it a digital format? Is it a print format? Is it a online format? What kind of format are you looking for? We also do write for social media content, right? So nowadays, social media is absolutely important and no client can ignore that. So you can also create a lot of content for Facebook. You can create flyers for Facebook, posters for Instagram, and posts for LinkedIn, and shorts for YouTube, right? They're called as shorts, right? 30-second. Why 30-second? Because the attention span has definitely come down and everyone wants to consume content as the shortest possible time. So these are the different ways how you can create a portfolio. And one of the easiest way to learn more is to please reach out to Dharmpal and Dr. Satabdi on LinkedIn and get the conversation going, right? So if you have registered.
Manoj.
Yeah.
Sorry if I'm extending. One last point is for freelance medical writer, important etiquette is taking feedbacks. Any feedback will not be good from a client initially to a freelance medical writer. Any feedback you get it, don't take it negatively, take it positively, learn from it. It's not that client may be right or client is wrong, but client is the center here. So whatever you want to do, you have to please client and get the project out to him. So always any feedback given to you, take it constructively, work towards it. Don't take it to your heart, take it to your brain. See how you can improvise from your experience and the feedback.
Absolutely. So feedback is most important, and that is where most of us get disheartened in the beginning, right? When I started my career, I used to get nasty feedbacks from my managers, and they kind of used to discourage me like hell, right? And then
you are here now.
Yeah. So, and those feedbacks actually changed the way I perceive the feedbacks from clients today, right? So taking negative feedbacks and converting them to valuable content for the client is absolute way of becoming a great freelancer. And I wish all of you become great freelancers or content creators, because it is the creators economy today. Even all this, you go and search for research today. This is, the creator economy is coming now. In next 5 years, it is the creators will be ruling the world, right? So be a great creator, because that's the only way to fight misinformation that is circulating on social media, right? And researched content has no second opinion, right? So be a good researcher, write research content, great research content, and learn the art of writing. And how do you learn the art of writing? Understand the tools and softwares that you can use, and don't just depend 100% on this artificial intelligence and machine learning softwares, because today they are there, tomorrow they may not be there. And we are working on a domain which is very reserved, which is very regulated, right? So we are not supposed to use such tools as such. Of course, use them for getting ideas and ideation purpose only, but do not depend 100% on those tools. So with this, thank you so much, Dharmpal. Thank you so much, Dr. Satabdi. And thank you everyone for spending so much of time with us. And I hope this session was useful. And with this, we end the session today, and meet us next week again at the same time, and we'll continue this learning journey. All right, so stay connected on LinkedIn if you have not followed all of us. So please do follow on LinkedIn and on YouTube as well, so that you get contents like this every week. So thank you so much, and I wish you all.
Thank you, Manoj sir. And I am learning every day from your YouTube videos, from your posts, and I hope to keep learning from seniors like you. And thank you for having me. It was a great experience.
It was a great having you here, Dr. Shatabdi, and learning a lot from you. And we learn from each other, and that's how we grow together. And thank you so much, DP, for pitching in. And DP is like a mentor to me all the time. Thank you so much, DP, and we learn together again. Thank you.
We always learn together, Manoj. Thanks a lot.
You.
Thank you, sir.
Thank you. Thank you, DP, and thank you, Dr. Shatabdi. So I'm disconnecting the live stream for now. Thank you so much, everyone on YouTube for joining us here. Thank you again. Thank you. All right. So thank you.